All right. Good afternoon. It's almost afternoon, I believe. So anyways, I'm Eleanor, one of the TMS clinicians here, and I'm joined today by Regina.
Yes.
How are you doing, Regina?
I'm good, thank you.
So tell us a little bit about yourself and your journey in terms of your mental health.
So I'm 61,
Uh-huh.
and basically, as long as I can remember, I had headaches, which later turned out to be tension headaches.
Mm-hmm.
Started, according to my mum, already with 3 years of age.
Mm-hmm.
And from the age of 10 years, roughly, I know that I didn't really wanted to live, that I would be dying, or that I would have a horrible disease and would die of this.
Okay. So this is the thought you had at 10 years old?
Yes.
Yeah.
Yes. And so basically, when I became a teenager, my headaches got worse, and because of this, I was sent to a psychologist. And I started group therapy sessions, which I did for roughly 10 years.
Oh, wow.
During this time, I got quite addicted to painkillers because of the
headache, yeah.
Yeah. And I had to go to rehab for 3 months, and that's when I stopped with the group sessions, and that's when I was diagnosed around 30 years of age. I was diagnosed with PTSD, anxiety disorder, and chronic depression.
Yeah.
And basically from then on, I saw a psychiatrist, saw a psychologist, and have been on numerous antidepressants. Yeah. Because for a lot of years, partially due to the headaches, but for other reasons as well, I was actually suicidal.
Okay. All right. Now, and how did you come to hear about or know about TMS therapy at this stage?
I actually had talked with my GP. She recommended DMR, and when I talked to a colleague of mine, her partner is a neurologist, and she told me about TMS, and that this would be now available through Medicare.
Sure, yes.
So I talked again to my GP and asked if I could have a referral and try this before I would go through the IDMR.
Okay. Yeah. And so she decided to
give me the referral.
Yeah,
yes.
Okay.
And that's when I booked here.
Nice. And did you know about any other, like in your circle, have you known about anybody personally that's ever done TMS, or is this the...
No, this basically was for me the first time.
Yeah.
But just because of my profession, we talked a bit more about
That's
it.
right.
And I got told then by colleagues that their friend had it and these sort of things.
Oh, okay. But otherwise, this is very new in terms of... Oh, cool.
Yes.
So, and then how frequently did you come into TMS treatment? Because I know 35 treatment is an acute course.
Yes.
Yeah.
The psychiatrist I saw here for the assessment, he basically said I would need to come in on a daily basis for a minimum of 20 sessions.
Yeah.
And when he said that, I just decided to do it for the
35,
sessions.
that's right.
And come in basically 5 days a week.
That's good. You feel like we've known each other over those 5 days a week.
Yeah, it feels like home.
Yeah. And have you seen any changes, any improvement in terms of your anxiety, your depression?
At the beginning, which coincided with time of work, after 2 weeks I noticed that I slept better, and then probably after 2 weeks, or altogether after 4 weeks, I looked back and I had noticed that for 2 weeks I did not take any pain relief for my headaches.
Wow.
Which never ever had happened in my whole life.
That's amazing.
Yeah. So I always, till then, I always had taken paracetamol and Nurofen.
Yeah.
But I never had 2 weeks of any pain relief.
Wow.
So yeah.
That's a significant improvement considering. Yeah.
Definitely.
Wow. I'm glad to hear that. Now, in terms of in terms of side effects, did you experience any?
No, nothing at all.
Yeah.
nothing whatsoever. Yeah.
Wow, that's good. And as a recipient of a TMS therapy and as a healthcare clinician, what's your overall take on TMS therapy?
My overall take, for me personally, is that it is very, especially when you can make other changes to your life. But I think, especially for me, because I had this time of work and I had the TMS, it showed me also that work has a huge impact on my anxiety. And it's almost like confirming what I saw before, that I would have to change things in my life, which before I never thought about that much.
So you removed from work, and you're able to reflect on what the cause of the anxiety was, so the primary cause for you.
But especially before, when I were on holidays, I still always had headaches.
Wow.
So this time, even so, I could basically see it as holidays. Definitely the TMS brought me onto the right track and changed my anxiety. That's
phenomenal. I'm so happy to hear that, and I'm happy you gave it a chance.
Yes, me too. I only can recommend it.
Well, that's fabulous. Thank you so much for coming back to hang out with us one last time.
Thank you very much.
We're honored and privileged to have been a part of your journey in terms of recovery.
It was a pleasure to meet everybody. That's really.
And we hope to see you in perhaps 4 months.
Yes. I booked it already in my diary. A reminder.
That's awesome. All right. Thanks again, Regina, and we will see you then.
Very welcome, Eleanor. Thank you.